Welcome, and thank you for watching our video entitled Successes and Cautions of JELMYTO Instillation for Upper Tract Urothelial Carcinoma. Upper Tract Urothelial Carcinoma, or UTUC, is an uncommon malignancy with limited treatment options. In this setting, the FDA approved UGN-101, or JELMYTO, in 2020, which is a mitomycin-containing reverse thermal gel and can be utilized in the treatment of low-grade UTUC as well as in select patients with high-grade UTUC. This intracavitary chemotherapeutic has demonstrated promising oncologic effects, such as in the Olympus trial, for example, and as a result, JELMYTO is currently being used not only as a solitary treatment for low-grade UTUC, but also as an adjuvant treatment to endoscopic laser ablation. In this video, we will outline an example of how we have used JELMYTO as an adjuvant treatment to thulium laser ablation of UTUC tumors, highlighting the anti-tumor effects, but also demonstrating the potential pitfalls of ureteral scarring and stricture formation that can result as a chemotoxic effect of JELMYTO instillation. Here we show OR footage of thulium laser ablation of UTUC for a 77-year-old male with a history of prior right radical nephrectomy for renal cell carcinoma, who was subsequently found on biopsy to have multifocal low-grade papillary urothelial carcinoma. Given the patient's advanced age, compromised renal function, and multiple comorbidities, he decided to undergo an initial 6 induction treatments of JELMYTO to chemoablate and effectively downsize this large tumor burden. Following these treatments, ureteroscopy demonstrated what is shown here in the video, which was substantially reduced UTUC tumor volume, which was then maximally ablated endoscopically using the thulium laser in a consolidative manner. Recent literature has shown that when JELMYTO is used as an adjuvant treatment to endoscopic resection of UTUC, as compared to when it is used as a solitary chemoablative therapy, there are significantly fewer disease detections. In fact, a recent retrospective analysis found that at first endoscopic evaluation following adjuvant treatment, roughly 70% of patients were without visible disease. Further, additional research suggests that, similar to this patient's regimen, JELMYTO may play a role in initial chemoablative cytoreduction of large volume, low-grade tumors that may not initially appear to be suitable for ablation. Although longer follow-up is needed to determine the long-term durability and consequences of JELMYTO after complete endoscopic ablation, or the utility of JELMYTO cytoreduction prior to endoscopic resection, these findings are encouraging. Take a look here at surveillance ureteroscopy following endoscopic ablation with adjuvant JELMYTO. Fortunately, this patient had no evidence of tumor recurrence, further supporting the chemoablative nature of this modality. However, JELMYTO is not without its chemotoxic risks, which notably include urothelial scarring and stricture formation. Appreciate the blanching of the ureter and renal collecting system, sequelae analogous to that which has been previously observed for intravesical mitomycin used in bladder cancer. This is likely the result of the inflammatory insult and scarring that JELMYTO can cause. You can further appreciate the risk of stricture formation as shown by these intraoperative photographs. Patient A and B both completed induction JELMYTO but did not proceed to maintenance treatments in the setting of either ureteral or calyceal strictures that were observed on follow-up ureteroscopy. Fortunately, both patients have remained without a clinically significant stricture. However, these risks should certainly be considered and are consistent with prior literature that have demonstrated roughly a 20 to 30% stricture rate following JELMYTO exposure. In summary, JELMYTO instillation demonstrates encouraging oncologic outcomes both when used as a solitary and adjuvant treatment in select patients. However, these benefits should be weighed against the known and observed risks of urothelial fibrosis and stricture. Further studies are necessary to determine the long-term durability and side effects of JELMYTO.